I'm Kevin Rathke. I'm a neurologist at Duke University. I run the ketogenic diet clinic there. We're going to kind of do an overview of the ketogenic diet and then open up for questions. So what is it, ketogenic dietary therapy? I prefer the European ketogenic dietary therapy to separate it from the ketogenic diet here, because we talk about the keto diet, which is a completely different animal than the ketogenic diet. It's not starvation, and it's not natural. We have a lot of patients that say, I want the natural diet. It's very unnatural for your body to be in this state. And what we're doing is we're trying to push the brain to accept ketones as a fuel instead of glucose. And ketones help reduce seizures. And the most important thing of all of this is a really, really good dietitian. So why use it? We know that 30 to 40% of epilepsy patients do not have complete seizure control with medication. And after failing 2 medications, your chance of any meaningful control with another medication is less than 5%. And that leaves you with surgical options or dietary options. It can work pretty well. Over 50% of children who start the diet have 50% or fewer seizures, and 10 to 20% may get up to 90% reduction in their seizures. And most patients respond within a few weeks. So it's one of those things that if you try it and you get to a good level of the diet, you would see response pretty quickly. When should it be offered? It's really when it's safe and appropriate. The International League Against Epilepsy recommends it after failing 2 medications, again, because your chance of another medication causing any meaningful improvement is pretty slim. You also need a very knowledgeable and eager patient and family, because it can be difficult, and it's not for everyone. It's difficult and time consuming, preparing meals, measuring, weighing. If a child's used to eating kind of regular food, sometimes it's hard to transition into eating the types of foods that are served with it. And patients need regular monitoring. Contraindications for it: really certain metabolic disorders like mitochondrial disorders, carnitine deficiency, fatty acid oxidation, and pyruvate dehydrogenase deficiency. Also, porphyria can be a contraindication. Looking back, so this has been around for a long time. Hippocrates in the 5th century BC reported a man with epilepsy becoming seizure-free when abstaining from food. And there's also a biblical reference where prayer and fasting can cure seizures. But it wasn't until the early 1900s that Dr. Conklin, who thought that seizures were caused by toxins in food, switched people over to this kind of starvation diet and got seizure control. But in 1921 at Mayo Clinic, Dr. Wilder kind of discovered that it's the low carbohydrate that is what helps, and then providing protein and fat, and he coined the term ketogenic diet. I mean, it was really Johns Hopkins in the 30s that took it to a new level and made it a real therapy. And that was lost for a while, probably due to new medicines coming into play. Some renewed interest in the 70s, but it was in the 1990s with Charlie Abrams, who's the son of Jim Abrams, who is a writer and director. He did movies like Airplane, things like that. Had medically intractable epilepsy, went to Hopkins, which had a small clinic, and he became seizure-free, which led to Dateline, a Dateline story, which, of course, when it's on TV, everybody gets involved. And then Jim Abrams put together a movie called First Do No Harm with Meryl Streep, which made it even more in the public eye. He also developed the Charlie Foundation, so anybody on the ketogenic diet is usually familiar with this. Later by Matthew's Friends, which is the European equivalent to Charlie Foundation. And it's now become a very accepted therapy. There are variations like a modified Atkins diet, a low glycemic diet, but there's still a lot of research to be done with the ketogenic diet. How does it work? Well, we know that fatty acids are metabolized in the liver to ketones, and that's why you need fat available when you do the diet. The number one ketone that we monitor is the beta-hydroxybutyrate. And unlike glucose, which needs a transporter to get into the brain, ketones flow freely in the brain. But your brain doesn't like to use ketones unless the glucose level is low enough, and that's why you want to get the low carbohydrate. And you can't just take a bunch of ketones. How it helps seizures is not fully understood. We know that it can decrease the amount of stimulatory chemicals in the brain, so that could help seizures. It also increases the amount of inhibitory chemicals in the brain, which could help seizures. And it also can reduce some of the harmful effects of the chemicals that are released during seizures, so maybe long term it can help by reducing those chemicals. So it can be very effective, but it can be very challenging. You need the right family, they have to be eager and want to try it. And patients really need to be monitored. They can have arrhythmias, they can have all sorts of side effects, which we're going to talk about in a minute. There may be some other uses. It's been looked at in malignancies, also psychiatric disorders, bipolar disorder being the main one. But we still have a lot to learn about the disorder. So now I'm going to pass it off.
So part two, I'm Sarah, one of the ketogenic dietitians at CHOC Children's in Orange County.
And I'm Susan Fong, I'm a pediatric epileptologist at Cincinnati Children's.
So what we're going to talk about is what does the keto diet look like? So in general, keto at a glance, we know it is a high fat, adequate protein, and a low carbohydrate diet. What we mean by adequate protein is that you work with your dietitian to understand a little bit more about what is the minimum required of protein that we need for our own bodies. And that's because protein itself can actually be broken down into sugars, which would then be not equivalent to what we need in producing ketosis. So that's why you work closely with the dietitian. It is a medically supervised diet, so we want to make sure that we are working closely with our entire medical team. And it is effective treatment for epilepsy. And like we talked about before, it's usually used after a few medications have been tried and they haven't been worked. And good piece to know is that it is used for all ages, so babies all the way to adults.
So Sarah, I have seen a lot of people using the ketogenic diet. It's all over the press. People are using it to lose weight. I can find so much information about it, magazines, books. Can I just follow one of those things to do a ketogenic diet?
The answer is no. And kind of how we talked about before, the diet is really a medication. So we really want you to put those two pieces together there. Big piece is we're not trying to lose weight here. We're trying to keep kids growing, and we're trying to, if you're an adult, maintain where you're at as well. So calories are not restricted. And really the majority of your calories has now shifted from carbohydrates over to fat. So this pie graph here really shows you what pretty much the most restrictive sense of the ketogenic diet can look like. So you can see this is very different than what we're doing. Usually about half of our intake is coming from carbohydrates, but here on the keto diet it's 90% coming from fat, and only 4% from carbs and 6% from protein.
So it's clear that the magazines are not the right way to go, and there's a right way to do things. Is there only one right way to do things?
No, there are several ways we can do the ketogenic diet. So in terms of the medical ketogenic diet, there are 5 main areas that you can do. So the first one is the classic ketogenic diet. So that was represented from the pie graph earlier. It's prescribed in this term called ketogenic ratios, which basically gives us the proportion of how much fat, carbs, and protein are in your individualized diets. And you will be using a gram scale to measure all of your food. The modified Atkins diet, or MAD for short, is similar to the Atkins diet that many of you may be familiar with, but in terms of the medical diet, it's going to be more restrictive in carbohydrates. So usually around 10 to 30 grams of carbs is the restriction, and then you would use phone apps to help track your net nutrition. The modified ketogenic diet is as if you took the classic and the modified Atkins and you put them together. So you'll use the concept of ketogenic ratios, but instead of just tracking your net carbs on your phone apps, you'll be tracking your fat, protein, and carbohydrates. Then a newer type of therapy is called the low glycemic index treatment, which is still a high fat diet, so it's about 60% of the diet is coming from fat, but it does allow some more carbohydrates. your carbohydrates though on this type of diet, you are following something called the glycemic index, which measures your response to a certain carbohydrate with your blood sugar. For example, if you eat a white piece of bread versus something with a lot of fiber, the impact on your blood sugar could be very different. The last type of diet is called the MCT oil diet, which allows more carbohydrates because MCT oil helps produce a little bit more ketosis. So your diet would be really high in MCT oil, so about 30 to 60% of MCT. There are pros and cons to all the different types of diets, and sometimes when you work with your dietitian, you'll end up on a combination. So you really work closely with your team to see which type of diet therapy would work best, and sometimes it's a combo. So for perspective, we're going to show you what a classic ketogenic diet would look like versus a modified Atkins diet. So here you can see there's different plates here, and I know it's really small, but there's different little recipes for each one, but you'll see all these different ratios. And really what I want to hone in on is the least restrictive to the most restrictive. So your least restrictive is a ketogenic 1-to-1 ratio. So that's going to be for every 1 gram of fat, you have a collective 1 gram of carbohydrates and protein together. So here you can see that the plate is full of chicken, broccoli, and then I know you can't read all the little details, but there's also olives, parsley, mayonnaise, and olive oil. Versus on the other side in the red, you could see this is a ketogenic 4-to-1 ratio where there's for every 4 grams of fat, there's 1 collective gram of carbohydrates and protein. And here you'll see the plate looks smaller, but really we know that fat is over twice as calorically dense than the carbohydrate or protein. So really when you're looking at these two meals, the 1-to-1 looks like there's more food, but realistically, kind of like how we talked about beforehand, calories aren't restricted. So both of these plates are 400 calories. And that's just because, like I said, fat is more calorically dense. So the amount is going to look a lot smaller. And then here are just some pictures and examples of modified Atkins food. So again, all you're counting is net carbohydrates, but you're encouraged to do high fat. So here you could see good sources of fat like avocado, heavy cream, butter, olives, cheese, and then good sources of protein in there too, and then some low carbohydrate alternatives.
Is the ketogenic diet a complete nutrition, or do you need things to supplement it?
So you do need things to supplement, and that's because ketone-producing diets aren't nutritionally complete. So if you think about it, if you're doing a high-fat diet, the things that you are reducing or not eating a lot of include your grains, your fruits, and your vegetables, because all of those have carbohydrates. So when you take away those things, you have a reduction in the amount of vitamins and minerals in your diet. So we ultimately have to supplement in to make it a nutritionally complete diet. So it's usually tailored by your dietitian and your medical team, so talk with us and we'll figure out where your nutrient gaps are. And we also know that the ketogenic diet, like we talked about before, is a medical diet, so there could be some side effects. And some of these side effects need to be treated with additional supplementations. Ultimately, too, working with your dietitian to find what is safe, because the supplement industry is not regulated by the FDA, so we want to make sure what you or your child is taking is safe for them. So work with us on that. Baseline, you can see there's 6 potential supplements. So more than likely, you or your child would be started on a multivitamin and possibly some additional calcium and vitamin D. MCT oil, kind of like how we talked with the MCT oil diet. This one we may add in just to help promote additional ketosis. Carnitine is another supplement we might start. The diet itself uses a lot of carnitine to process all of that fat. So sometimes we have to supplement it back in because our bodies are just using more carnitine than we are on our typical diet. Side effect wise, we may use bicarbonates and citrates to treat. And that's because the diet can become very acidic in nature. Ketones are acidic. So we use these to help buffer out the blood. The last couple are soluble fiber and omega-3. Both of these help normalize the lipid panel. It is a high-fat diet, so we want to make sure that our cholesterol, our triglycerides, and all that are staying fine.
We've been talking a lot about different kinds of foods. You showed us all those plates with all the different foods. We've been talking about taking supplements. So does that mean if I have a baby who is maybe still on formula or breastfeeding, or maybe kids with a G-tube, are they able to do keto?
Yes. Anyone can really start the diet. So when it comes to, let's start with babies. So if your baby is breastfeeding or on formula, we can't do the keto diet. Typically with breastfeeding babies, we're using a combination of express breast milk, keto formula, and then maybe even using a little bit of those concepts of the MCT oil diet to augment ketosis. Because babies usually start with purees as their solid, you can mix together purees with different sources of fat to create a ketogenic ratio. Then for babies on formula or kids who are G-tube dependent on formula or drinking formula mostly by mouth, there's a ton of ketogenic formulas out there now. I have tried them all myself. They all taste pretty good, and I'm not on the keto diet myself, so saying that out loud there. And there's different ones that we can use for different allergies too. I know someone had a question about that earlier. So there's a peptide-based formula, there's a plant-based formula, there's this one that has real food blended into it and may not taste that great by mouth, but that one can be used by G-tube. And then also if your kid is tube dependent, then we can also do keto blenderized tube feeding if that's your interest as well. So in general, when it comes to this kind of diet, you're usually landing on the classic ketogenic diet because everything's already proportioned down. We're following all these specific recipes, the formula is already at a specific ketogenic ratio, and we found that there is really good tolerance and there's really high adherence with the diet. So your ketone production is likely to be higher with this. But that being said, because it is a classic diet and it is a little bit more restrictive, this is typically done during an inpatient admission to monitor how you or your child's body is changing with all of this addition of fat and reduction of carbohydrates. And we want to make sure that you're tolerating it, so there's no side effects, and if you are having side effects, we want to address them right away. And then that week-long inpatient admission also gives us time to really go over in-depth education so that you feel comfortable doing this diet at home, whether it be for yourself or for your child. An outpatient start is also possible, but this takes a little bit longer because we don't want to make as dramatic of a change over a course of a week, so we do take it slower. And then infants specifically, we would likely end at a lower ratio. So we're not going all the way to 4:1, we're probably sticking between 2:1 to 3:1. 3:1 as the ratio due to the risk of low blood sugars.
You were just talking about starting ketogenic diet in the hospital. Is that necessary? Can you tell me a little bit more about that?
So it's not necessary. We can start it outpatient. Some of the diets are baseline started outpatient, so that includes the modified Atkins diet, modified keto diet, and the low glycemic index treatments. And then kind of like how we talked about before, we have the idea of a low and slow method. So going very, very slowly on those ratios, and then having close follow-up to make sure everything's tolerated well. But in general, we want you to talk to your keto team so we can put together a specific plan that fits everyone best, because ultimately we want you to be successful on the diet, whatever that means. Inpatient method-wise, we would likely be starting at a 1:1 ratio on day one. We'll start you at full calories, and then we'll increase by a ratio on a daily basis until we get to a goal level. Usually there's some daily labs included, and that's because we're monitoring that any electrolyte abnormalities, your blood sugar, your acid level, and the amount of ketones you're producing in your blood. And then, like we talked about beforehand, there's going to be a lot of education. So usually there's multiple team members meeting with you to make sure that you understand every single aspect of the diet, because it's not just food. The medications can be affected too. How you triage if you or your child sick. All of that changes as well. So we want you to understand everything completely, know all of your resources so that you feel comfortable going home. And then with that said, there's a lot of close monitoring. So we want to make sure everything's going well. We want eyes on you or your child to make sure everything's going smoothly. So we have that as well. And that goes along with how many people are involved. We have a plethora of team members following you. So we have our neurologists, we have nurse practitioners or other PAs, we have pharmacists, we have dietitians like myself, and we even have social workers too to help really tie it all together into a team effort. But ultimately, the biggest player in all this is you and your family. We want to work with you. We want to make sure that this is feasible for you. So we want to make sure that we're all working together. So, Dr. Tom, I have a question for you. Is this considered a natural treatment, and can we get off medications with it?
Great questions. You know, a lot of people start ketogenic diet with the goal of helping the seizures get better, but a secondary goal of reducing medications, reducing side effects from medications, and we share those goals with you guys. However, as we mentioned earlier in the talk, it is typically recommended after a couple of medications have failed. So when you're starting out, you're probably already on a couple of medications. Those are typically continued when you first start the diet. Because, you know, just as with any new treatment, who knows how you'll tolerate that first start of the treatment, right? Maybe you'll do it for a week and you'll have horrible side effects. Maybe it'll be very ineffective. Maybe you'll be off of it very quickly. So we don't want to stop your meds right away as you're starting a new thing. And that's probably familiar with you. When you start a new medicine, you probably don't stop all of your old medicines right away either, right? So in the same way, you would probably be on the same medicines as you start your keto treatment. There might be some modifications to them. So if you're on liquids, they have a lot of sugar in them. They might have to get switched over to pills so that we take the sugar out of your liquid medicine. But then some patients have very specific epilepsy syndromes where there are exceptions, and you may not be on any other medications. You may be just on keto. So it is very case by case specific. So it's important to work together with your doctor to figure out what the right thing is for you. Now, in terms of efficacy, we alluded to it earlier, but you know, we know pretty early on if it seems like it might have room to be effective. Some people start showing improvement, you know, days into starting, but I tell everyone you have to give it some time. We're putting your body through a very big metabolic change. We're changing how your entire body functions, not just the blood getting into your brain. But your heart, your muscles, your lungs, every single cell in your entire body is shifting to this new kind of metabolic process. And you have to give that process time. Now, if you stick with it, about 2/3 of patients who start the ketogenic diet have a good improvement on it. And about 1/3 have 90% seizure reduction. And that's massive when, as we talked about earlier, drug number 4 or 5 or 6 may not be likely to give you very big improvements. But again, it is a treatment like anything else. So it's not a guarantee. It doesn't work for everybody, just like your last medicine didn't work for everybody. So about 1/3 of people who try the ketogenic diet, it's not effective for them. So you just have to give it a try and see what happens.
So after everything I'm hearing, and if I'm ready to go, can I just start?
So talk to your team, get in touch with your team. Most people with epilepsy can do some version of the ketogenic diet, but as I talked about earlier, it's important that we check where you fall. Some patients seem to respond even better than other patients. There's a list, you don't have to be able to read all of that, but there's like a dozen things on that list on table 1. Those are diagnoses where we have evidence that shows ketogenic diet seems to work particularly well, like even better than the average numbers for patients starting ketogenic diet. And then there are other conditions where it does work, just not quite as well. But in a similar way, it's important to know that there are some conditions where it's contraindicated, which means in these patients, it would not be safe to do. We're changing your body to use fat as its energy source. And if you have a medical condition that doesn't allow your body to use fat appropriately, then it's not safe to put you on this diet. So we do have to check for these things before you start. So we do some testing before you start, mostly blood work, to make sure that you don't have a contraindication that prevents you from starting. And then we do continued labs as long as you're on the diet to monitor things for continued safety. So it's important to work together with your team and make sure that this is the right thing for you.
So food is completely natural, right? So there should be no side effects that can happen.
I would love for that to be true, but it's not. The ketogenic diet is a medication. I tell people really think of it like a seizure medication in so many ways. Meds work for some people, it doesn't work for other people. It can cause side effects for some people and not for other people. But it's important to know what kinds of side effects you might experience while you're on it. There's a different sort of list of side effects ones that you have early on as you're starting off on the diet, and then a different set that you sort of might develop over time of being on the diet long term. So some of those early symptoms and why, for babies or somebody on a higher ratio, why we might be starting in the hospital is so we can watch for some of these things. So dehydration, low glucose makes sense. We're doing a low carbohydrate diet, so maybe your glucose drops too low. And if that happens, you get very tired and lethargic. We mentioned earlier about becoming too acidotic. The ketogenic diet is an acidotic environment, so it can get too far along and then be overly acidotic. You can have weight loss, as we know about. That's why a lot of people try to do sort of a minor version of this for weight loss, right? But some people have weight gain. The most common side effects are GI related, so upset stomach, nausea, vomiting, reflux, things like that. One key little asterisk that I say about the reflux though, remember ketogenic diet is a medicine and food is your medicine. So if you're refluxing and that causes you to vomit your meals, then now you're not getting your medicine, right? So vomiting meals of a ketogenic diet is kind of like skipping doses of a medicine. So these are all things that we have to think about and fine-tune your diet to make it work for you. And then as you stay on the diet long term, there's sort of different possible side effects that we need to monitor for. So there's the potential for low bone mineral density, that could potentially make it easier to hurt yourself, get fractures. There's some idea that it might decrease your maximum height potential if you started really early. You're eating a lot of fat, so it makes sense that your cholesterol might go up. So we're watching things like cholesterol and triglycerides. We mentioned earlier about using carnitine a whole lot more than we would on a normal diet. So you could have low carnitine that needs to be supplemented. And then kidney stones are somewhat common, but it can be easily treated or prevented with some extra treatments, extra medications. So those things might all apply. So to help us keep an eye on those kinds of things, there's different kinds of testing that we do. You're going to do some amount of testing at home, and depending on what institution you're working with, the exact regimen for how they have you monitor at home is going to be different. Some places are going to be doing urine checks. Some places are going to be doing blood checks with a meter at home. But you'll get education about how to monitor in your situation as you start with your dietitian and your physician teams. In addition to that, you're going to be getting blood labs done at the laboratory on a not too frequent schedule, once before you start, once 1 month into starting the diet, once about 3 months into the diet, and then so long as you stay on the diet after that, you'll get some monitoring done with blood work every once in a while. All of your supplements might get adjusted up and down depending on what we find on some of those lab works. So those things will vary. And then in addition to that, things will get discussed as safety issues come up and side effects and concerns come up at your follow-up keto clinic visits.
So, do I have to continue the diet if it is working for me?
Well, if it's not working for you, it does take a lot of time and effort to do so. No, you absolutely do not have to continue on it. But there's a safe way to start and a safe way to stop. Just like with these seizure medications, if I built your dose up over a few weeks and got you to a good dose to see if it works, you determine that it doesn't work, we don't cold turkey just stop it one day, right? So just like I said earlier, keto is a seizure medication. And so if I built you up to a high ratio in the hospital, discharged you home, you tried it for 3 months and it's not working, absolutely we want to get you off of it and get you off of it safely. But you don't just cold turkey stop and then dive into the ice cream bowl the next day. So you do have to do it safely. One other thing to consider is if you've tried keto in the past and you thought, well, that didn't really work and you moved on to other things, that doesn't mean it's not worth possibly reconsidering at some point in the future. You may have had similar experience with medications that didn't work at one time point, and then many years down the road, maybe that medication is a better option for you now. Or it may have been, how much supervision did you have the first time? Were you trying to do it on your own? Did you feel like you were, reading books and trying to figure it out, and now you found a team that can help you a whole lot more? Or in the case of you had horrible side effects that made you horribly sick, you needed surgery for kidney stones. Well, maybe that's not the right situation to try again. So again, your team can help you decide if it makes sense to think about trying it again or if that doesn't seem like a good idea.
What are my next steps?
So your next step is talk to your epileptologist if you think that this is something that's of interest to you, and they will get you set up with an appointment in Keto Clinic, which, as you've heard already, is usually a whole team of people working together with you to figure out what is your current situation, what seems like the best way to get you started, and then help you do that. The Charlie Foundation and then Matthew's Friends also, we mentioned earlier, are good resources. You can go on there to get an idea of things that are available. It can also give you an idea of all the wonderful ways that keto food can look. I think sometimes people haven't envisioned like, brown, cardboard-looking, dry, unpalatable food. It's really not true these days. There's recipes for everything under the sun now that can, with a little bit of effort in cooking and preparing the food, it can really meet most people's needs for things. So it can give you an introduction and an idea into what options there are. But again, I caution you, I do not recommend trying to do it on your own without some assistance.
We would like to open it for questions.
Have you seen hair loss as a side effect? And how do you address it?
So I have seen some hair loss. It's not very common. It's also hard to say in those situations if it's definitely from keto, because so many things can change hair. I do see this often in the case of use together with Depakote, valproic acid. But that's also because Depakote by itself can cause hair loss. So was it the Depakote, was it the keto, was it the combination, or, we all go through changes. I don't know, many of you have had birth children and lost a lot of hair. A lot of things can change hair. In terms of what we do for it, at first I ask how bad is it, because it's cosmetic, right? At least it's not a medical safety concern. But if it's bad enough, then sometimes there are some supplements we can try. It's not very good, it's not great, but it doesn't hurt to try. So it's a combination of different vitamins and supplements that you can purchase. One of those things though is biotin. The biotin can interfere with some laboratory testing. So it messes up the values that get read on some laboratory work. So that's another thing to consider. If you're taking supplements that we know are gonna affect your lab numbers, then it's a little bit, how much do you really wanna take that venture? Yes.
Is it sustainable? Can you do it forever, or is there periods of time you have to go on and off?
A lot of things used to say that you can do like 2 years and that you should stop afterwards. I would say these days that's more challenged because there are diagnoses, for example, gluten deficiency disorder is one of them, where you lack the substance that brings glucose into the blood, and so you cannot feed your brain using glucose. It's physically impossible for that patient to do so or to do it well. And so in the case of GLUT1 patients, they're on some version of keto essentially for life. But even in those situations, you tend to start out, higher ratio, higher doses, I call it kind of. And then over time, you sort of come down on ratio so that maybe eventually you're on a modified Atkins. And the longer you're on it, of course, continued monitoring is hugely important. But most people don't need as strong of a dose/ratio years down the road as they did when they first started. So most people can come down, but I would say in certain situations, people are on it very long these days.
I have 2 questions. One is, someone's diabetic, they can't really be put on the keto diet, correct?
So it's not a contraindication. It can be done, and I would say it's unrelated to this group, but my husband's an endocrinologist. So just so happens that endocrinology is becoming more and more interested in how ketogenic diet could be helpful for their patient population. So again, this is outside of the scope of my practice, but I will say that diabetic patients can be on a ketogenic diet, and they just need close following together with the neurologist and the endocrinologist, because especially if they're on insulin, their medication regimen is going to have to get adjusted very frequently. So you need a team who's willing to work together to make sure it's done safely, but it's not a contraindication.
Okay, and what about like dogs that have seizures? this something that people can use for their dogs to try?
I don't know of any data about dogs, do you?
You think it would work?
Theoretically, it seems to me like same thing, right? You probably have to monitor, but I just don't know dog physiology, but one would
Dogs
assume
use a lot of the
so,
same
but
medications.
yeah, one would assume so, but I don't know. Yes.
Something about habitat, or like, so, question is, if my daughter has seizures, but she's lost a lot of weight, she's really thin, would she have to like put on before starting the keto? Or does it really, does your weight matter, or is it like how much fat you have in your body?
I think that's a multifactorial question. Kind of how we talked about before, since the diet is a medication, we need to ensure that your child is able to take all of her medicine and her diet. So if that's feasibly possible, then it's something that would be built in. If your dietitian has a concern about weight and everything, then we would probably address it altogether as well too. Yeah.
I'll just say, I do have some patients who came to me with concerns for being underweight, right? Not being able to put on weight. And with a properly formed plan and proper monitoring, we have watched some of these children gain weight in a way that they haven't previously been able to do.
And that's one of the parameters we watch very closely is weight, because you also don't want somebody to drift down or drift up, and that's why the dietitian is important, because they can adjust calories as needed to maintain an ideal weight.
Yeah, because I've had like a really hard time getting her to keep, and I think a lot of times certain medications, they have a loss of appetite, so some of her seizure medications, like she just doesn't want to eat. I could barely get her medicine.
Yeah.
She's fighting it.
Yeah. So, it'll have to be, assessed individually whether or not she's in a safe state currently, and then if not, then how might they might be able to help her get there, or if she's safe but on the borderline, then how would they monitor to make sure that she continues to be safe, Yes.
Is it as effective in adults with epilepsy than it is in children?
Yeah, great question. We have a lot more data on children because we've been using it for so much longer in children, but we have a growing body of literature showing data in adults as well. And it's a little bit harder to do for adults, especially in the very strict high ratio versions, because more of us are used to what you've been eating for so long. But modified Atkins, there's a lot of literature on modified Atkins in adults doing it, for prolonged periods of time. And yes, it seems to be as effective. Now, there are certain kinds of, the table that I had up earlier, there are certain diagnoses that those are, really childhood things, and so you wouldn't really see those in adults. So, but in general, yes, it's effective for adults.
On your chart that you were showing, like the differences between the MAD diet and the low glycemic, I noticed the MAD, you mentioned net carbs, and on the low glycemic, it was like a little bit higher, it was like 40 to 50, but it said grams. Is that just calculated differently because one is taking out fiber and the low glycemic you're not taking out fiber?
Yeah, low glycemic where you would focus on a certain list of foods that are considered low glycemic, and those your carbohydrates are coming from that. Versus on modified Atkins or modified keto, we're teaching you how to track all of these net carbs, and you're having to factor in how much fiber is in the food, what are the safe sugar alcohols, because you Google keto versus medical keto. Google keto, you can eat any type of sugar alcohol or sugar substitute, but on medical keto, there's only certain sugar alcohols that we can subtract out. So,
A follow-up real quick on that. So, they have like keto bread, or they have, tortillas, and they all say like 4 gram net carbs.
Yes.
On the back, it's maxed out.
Yes.
Are those okay on the modified Atkins, or are those not considered?
controversial question amongst keto dietitians. I would say that's a new area that we are having to face. But, some dietitians have seen that using those products, these keto products, have shown lower ketosis.
Okay.
So some dietitians recommend like a more whole foods-based diet to start out with. But other dietitians allow it, and it really depends on how everyone's body reacts to it. I will say all of these net zero carb foods they're always questionable because as a dietitian, I think, how could something count as 0? It just scientifically doesn't make sense. So we want to keep that into consideration, especially if it's a large portion of somebody's diet.
Just as a general sweeping statement that's not true of everything, I would say most of what you read on the label that says keto friendly, Atkins friendly, most of that is not appropriate to a medical ketogenic diet. And I'm sure that, with individual checking, if you have a specific product that you're interested in, you can talk to your dietitian, they can look it over, and yes, there's a discussion about how much of some of these newer products are appropriate. One thing I can say from experience is that a lot of patients, again, as I mentioned earlier, you just need to be a lot more strict in the beginning, and later maybe you can be a little bit less strict. And so that's something that I've used for some people who otherwise are like, I can't sustain this, right? This is just too hard. I need something. And you just start out strict for a little bit. And then after you've been on it, you've reached ketosis, you know what you're doing, then maybe we try like one of these things. Are you okay with that? Some kids react poorly, some kids don't. If you're doing okay with it, then in moderation you try, So it's sort of a trial and error.
Is the big thing with that, is the big thing with that making sure that they're staying in ketosis? So like if, say I'm testing her, right, I have the urine strips or I have the blood pricks, and if she's like showing like almost in the purple, which is like super between the 80 and the 160, and she is having a keto tortilla or 2 pieces of keto bread, because that's the way I can get her to like eat more, or if she's just picky, is that okay as long as she's staying in ketosis? Is it more important to stay in ketosis, or like those things are bad?
Staying in ketosis is important, but it's also not the end-all be-all.
Okay.
So we look at the numbers because they tell us how well you're sustaining this new state of metabolism, but the ketone itself is not actually the therapeutic drug. So it's not like the higher your ketone, the more drugs you have in your system. It's not really, doesn't map out like that. So yes, I think if you were to be high ketosis and then have a tortilla and then you go to 0, that's concerning and probably shouldn't keep doing that. But just because you sustain it doesn't necessarily mean that it's not affecting her diet. So you just have to try it and see. Yes.
Have you seen any? I'm sorry.
We'll get
So for the question with the bread, there's a really great recipe that you can find all over that's for cloud bread. And you can use that. You can flavor it, make it like a focaccia, that sort of thing. Yeah.
Cloud bread?
Yes, and you can use it for buns for hamburgers so that you have something.
There are definitely recipes for almost anything. So if you have something that it's a must-have in your family, you can tell your dietitian this is a must-have item, and they'll probably be able to give you anywhere from like 3 to 10 different versions of recipes that are appropriate to try. But these are recipes that require like making it, right? Buying ingredients and making it. So it's more effort and time. I won't lie, the ingredients that are keto friendly are more costly ingredients than the straight flour versus the almond flour price tag is different, right? So those are all things to know. My earlier statement was more about like ready-made products, right? Things that are off the shelf and labeled keto friendly. Just be cautious, most of them are not. Sorry, go ahead.
Yeah, good question. Have you seen any modifications related to behaviors or mood? Because after you start, any effects in mood or behaviors?
There's a lot of data on that actually, and I have quite a few patients who have some improvement in seizures, but if that were the only benefit, maybe it's not good enough, they wouldn't have continued on the diet. But between some amount of seizure benefit and then there's oftentimes people report better sleep or better mental clarity. I have a lot of colleagues who have tried ketoing themselves. I have not, but and they'll describe it feels like the clouds parted, the fog cleared, this like mental clarity and sharpness. And so kids have that too, right? And you can see that in their learning, in their engagement, in their like interaction during the day. And so those are all reasons that are valid reasons to continue the diet.
And there's more and more data with psychiatric disorders that can help autism, and it's really that it kind of evens out the fluctuation in those behaviors.
The reason I'm asking because my son is autistic, and one thing we have seen is food can trigger behaviors.
Oh yeah.
food can trigger behaviors.
And actually, he had a big meal of carbs, and 10 minutes later he had behaviors, and 10 minutes later he had a big seizure.
You know, from a simplistic point of view, think about you and I, right? Like we take like Halloween candy and then like 2 hour later you're on a high and then sugar crash, right? So like that's on a miniature scale, but imagine that sort of translating to your kids. So.
You mentioned, you want to do this after you've done 1 or 2 medicines first and then see if that doesn't work, and this will probably be the next step. Why not start with this?
That's based on data that we have for where the statistics are in terms of chance of seizure improvement. So I did say that there's a caveat that there are certain specific disorders where that wouldn't necessarily be the case. So for example, if anyone gets a GLUT1 diagnosis, GLUT1 deficiency syndrome diagnosis, then it is the go-to treatment. That's the first treatment, that's the right treatment. And you don't have to have tried and failed 2 meds. That would actually be a waste of time. So it does depend. There are certain situations where this is the first and right treatment, but in most situations it is intended to be used for people who have refractory epilepsy, which meaning the first and the second medicine did not work. The reason for that is because the chance of the first medicine giving you seizure control versus the second is still pretty high. Once you get to seizure drug number 3, 4, 5, 6, 7, the chance that those are going to give you seizure control become minuscule, right? Like less than 5%, minuscule. And so at that point, other options, so that includes diet and surgery and devices, right, become the better option to try. And diet can be done concurrently with all of those too. You can be on meds, on BNS, have an RNS, have had surgery, or be getting worked up for surgery, and still be on a ketogenic diet. Pale green shirt, back.
Does keto ever give you problems with sports?
With sports?
Yeah, just doing them. Because I have had lots of sports, and I wanted to do sports later. I was wondering if that would ever, if keto would ever come into contact with issue.
I don't have any issues with doing keto and doing any kind of sports. I mean, my sports guidelines are the same as any other patient with epilepsy not on keto. So, water, swimming, diving, things like that with supervision, but it doesn't change because of keto.
I was wondering if it is true that if you're on keto and then you get high cholesterol or high triglycerides, that you can't go on a cholesterol medication because it takes you out of ketosis, so they supplement sunflower oil. Is that true?
So there's pieces of that are somewhat true. So when you're on keto, your cholesterol does go up, but usually it goes up a lot in the beginning, and it tends to come down on its own as you stay on keto. So over time, you either normalize or get pretty close to normalize and don't require things like cholesterol medications. I have one patient who came to me who is doing keto on their own, just like looking things up, but their only fat source was butter. So this poor child was drinking cups of butter a day, like multiple cups of butter per day. And so I saw her after she'd been on keto for 3 years, doing it at home this way, and her cholesterol was over 500. So that's a problem. And so in order to fix that, we gave her the better combination regimen of fats to use. So we don't use 4 cups of butter, we use other oils. That could be MCT oil, that could be, and then we would work through replacing that with other things. Yes, she can still have a little bit of butter, but not that much. That's all it required. She didn't require medications to adjust that. And then after 6 months, she was back to close to normal. So most of the times, if your cholesterol numbers are that high, it usually means that you need to meet with your nutritionist to help you tweak things. Yes?
One of the contraindications was surgical focus identified by neuroimaging and video EEG monitoring. What is that?
So what that means is if you have one spot in the brain that, MRIs, imaging, your surgery evaluation, everything has pinpointed all of your seizures are coming from this one spot. This one spot is in a part of the brain that can be resected, and we can do surgery on that part. If we were to do that surgery and take that part out, that would cure the epilepsy. So in that situation, it's a contraindication. It's not recommended to instead do keto because keto is not a cure. whereas taking that spot out would be a cure. So it would be giving you a treatment that is not curative when you have a curative treatment, but then introducing you to a lot of potential side effects. So, yes.
So what if that were the case, and it was 60 to 70% chance that it would cure it, the laser ablation surgery would remove that area? Then would like the modified, but there is a chance that other parts of his brain could have learned, can in the future or have learned to have seizures. Then could he do, would doing a modified Atkins diet be beneficial to maybe
To go
keep
together
that
with the
from happening?
surgery, you mean?
Yeah.
Yeah. So we do this quite a lot because the surgical evaluation process, you know, it doesn't happen overnight. It's depending on where you go, it can be many months, right?
He's already had the surgery.
Oh, okay.
So
So yeah,
we're wondering
if it might
that
help.
would be beneficial
Yes.
to keep it from
Yes.
coming.
Yes. So we think of it I mentioned earlier, I think of keto sort of as another seizure drug. So you can think of it in the same way. So sometimes people have surgery and they're not immediately seizure free, right? But you may be still down the road, or maybe you're seizure free right now and you're on some meds, but we haven't started taking them off yet, right? So in the same way, keto or modified Atkins or any version of KDT can be one of your seizure meds that you're on either before or during or after surgery, right? And then as you start to, assuming that you continue to be seizure free after surgery, then you would start to reduce medications one at a time, weaning slowly, right? And in that sequence, if you wanted to, the KDT can be the last thing that stays on. So you're getting off of the other meds sooner, but you would still have some coverage from keto. And then, if that's not enough and you end up breaking through, then you go back on a medicine. But yes, we do use ketogenic diet as a therapy for patients who are surgical candidates in that way.
Is it common to have to supplement the keto diet with another seizure med and just have like a dual purpose?
You're probably already on one, remember?
Yeah.
You mean
So is
adding
there-
more after?
No, so you're already on like 1 or 2. My daughter right now is on, we call it kind of 2.5 because one was diagnosed for dystonia, but clonazepam kind of helps.
Yeah.
So, the goal is ultimately to wean off all meds, but is it common to have to kind of stay on one with the keto, or is it more common that you can get completely off?
For the types of patients we use it for, again, we tend to use it later just because that's where the data is, even though you could use it earlier. So a lot of those patients still end up on some other medicine.
Okay.
Maybe fewer or maybe lower doses.
Yeah.
Okay.
A lot of them still end up because they were hard to treat to begin with.
Okay, but the goal is ultimately you're wanting to decrease
You
those.
try.
Yeah.
Just like when we add a new medicine, you always think, we're going to get rid of it. I can't. You just don't, otherwise you're going to 10 medicines.
Yeah, because that's where we're at.
Or think of it just like you added on another medicine, right? Just anytime you're thinking keto, just substitute it in your head just with the medicine, right? So you started a new medicine, you become seizure free. What are you going to do after you maintain seizure freedom for a little bit? You're going to start weaning, probably not that one of the other ones, right? And then maybe you get completely off that one, and then maybe after a little bit of a break, you try taking off another one a little bit at a time, right? So it's the same process with keto. If you go on keto, you become seizure free, then after a little bit, we try to wean other things off. Yeah. Okay.
For the going back to the cholesterol part of it, so usually the LDL cholesterol is higher, or is it the HDL, or is it bad, or is it higher?
When you have elevations, it's usually the total cholesterol and the LDL that are high, and that we're trying to.
If it's the HDL, is it okay, or is it still something bad?
It depends on the person. It could be okay, it could be low, it could be high along with the other ones. But a high HDL isn't bad, but it just depends.
Thank you.
You mentioned vitamin D and calcium. Do you know if those are sold in jewels? I know I've seen them everywhere for adults only, which is like one that you have to like take and she will not swallow until
They have a lot of sugar in the children.
Yeah.
I know, that's why I was wondering if there's like a magical brand or something that she
They don't have a magical brand. You can get calcium powder that can be mixed into different things as well. Also, there's different formula, keto formula. So if that's incorporated into your keto regimen, that one is another additional supplement too.
Like a keto cow would have the vitamin D.
Right. Yeah. And they all have different amounts of different things, so depending on what you need more of, we may, that may be part of the selection of the formula. But in general, anything liquid and anything gummy and anything that dissolves in your mouth is probably not okay.
Not good. No, I took a long time to find some keto versions of like the store, but I haven't seen a calcium vitamin D one.